Hi, we're part of the Really Cool Humans Network. I'm Dr. John Hatch, and this is...
I'm Dr. Casey Oliver.
And today we're going to introduce you to our clinic. Welcome to the Neuro Clinic. Come on in.
So we just want to give you a little history, actually. We've been down here since January of this year, so 2015, and we put a lot of blood, sweat, and tears. Tell us a little about the clinic.
Yeah,
how did we do it? What happened?
We built it in about 3 weekends, pulling 40 to 50-hour weekends in a weekend. And they've just built this from the ground up. This has been our dream, to create this entity where we can come and help people from all shapes, sizes, and severities and difficulties of diseases and illnesses that need therapy, that need change. And this is what we created.
So we got a lot of help from another really cool human, Ryan Hatch, who's Dr. Hatch's older brother, general contractor, and he would come fly down on the weekends, and we got to do a lot of fun work in here. So this is our baby, this is what we built. So let's give you a little tour. This is the waiting room here, as you can tell. Plenty of comfy chairs to wait in, and we take a lot of pride in making sure that you don't wait too long if you come to see us, okay? So this is the waiting room here. We move on over in here. This is a really cool room. We got a couple diagnostic tools that we use in here. Dr. Hatch can introduce one or both of them.
We have both the vestibular tech called the CAPS unit. It allows us to test posturography and where your center of pressure is, where your balance is. How is that working? This is the sacodometer. It enables us to just look at the eyes and how the eyes are moving. And why is that important? Because the eyes are the only sensory system that activate every part of your brain. So if there's a breakdown in the brain, we should be able to find it and see it in the ocular system.
So as we go through the season, we're going to spend a lot of time talking about each piece of equipment that we're introducing here. Sacodometry, CAPS posturography. These are two things that we have every single patient that comes through our doors, we have them do. Whether they've been injured or not, we need a baseline to figure out how well their brain's working. So let's move on.
After you've had the balance test, after you've had your eyes test from a small portion, you come in here. This is our bread and butter room. And what I mean by that is we use a company called Micromedical that enables us to view the eyes and what they are doing in the dark versus what they're doing in the light, and different fast eye movement and slow movement. You would ask, why is that important? Well, how we see the world is different than what's happening in our brainstem when we don't have vision. So a lot of people with inability to stay asleep or insomnia or difficulty falling asleep, they got a problem with the ocular system, that there's a pathway that's not working while they're trying to sleep.
Most medical physicians will actually use this piece of equipment to analyze the vestibular system. So when I say that, one thing that pops into mind is balance. Okay, so if a patient comes in that has vertigo, they're complaining of dizziness, vertigo, their world is spinning around them, this is one piece of equipment that is phenomenal at analyzing what's going on with the vestibular system. There's an intimate connection between the vestibular system and eye movements. So if there's aberrant or dysfunctional eye movement, we can pick it up really easy. Okay, there's a hierarchy or kind of a 1, 2, 3 or an ABC. We should be able to gaze fixate on a target versus a pursuit versus a saccade like Dr. Hatch was talking about. So this piece of equipment is awesome because it helps us analyze better than anything eye movements in general.
We had one patient that was actually struggling with different levels of, he was diagnosed with autism and dealing with ADD and these other learning disorders. And what we found is in light, his eyes tracked and it seemed normal. But when he put the glasses on, he was completely in the dark. His eyes moved in the opposite direction of the head movement, or opposite of what it should happen. When the head goes back, the eye should go down. When the head goes forward, the eye should go up. And his brain was doing the opposite. Think of how that affects you. And so with that, we were able to then make a therapy program to get his brain working and get the changes he needs so he can do better in school.
All right, come on in here. This is my home. Okay, when I'm not out in the general space using a lot of these ancillary therapies and other therapies that we use out here, this is my room here. Dr. Hatch and I share rooms all the time. This specific table is a high-low table. So I'll just bring this up and kind of show you what we do. Do you want to bring the footplate down? So maybe you're thinking, let me give you an example. Maybe you know someone that has been diagnosed with a condition called POTS. Or there's orthostatic hypotension. You may know someone that if they stand up too fast, they pass out and fall down. Okay, these are not good conditions to live with, and so we use this tilt table in order to perform a very thorough examination and figure out what's going on from a positional standpoint. This is really cool because we can get a patient that just lie down, get nice and comfortable on this table, and we can position this table at certain degrees and measure essentially the autonomic nervous system. How's the autonomic nervous system performing or not performing? So this is a really cool piece of equipment that we've had here since we started at the Neuro Clinic. It also has some drop pieces that we have on here. If you've ever been to a chiropractor, that's a pretty common adjusting technique, is using drop pieces, where I use these pedals down here. These will move. So if you've got an achy back or an achy neck, this is a cervical drop piece, a thoracic drop piece, a lumbar drop piece. We can get these pieces of the table to move to help us in using the artwork that we use as chiropractors and doing adjustments. Because we love the nervous system, but we also just see people for neck pain, back pain, things like that. Let's head into Dr. Hatch's room, take a peek in there.
So similar like Dr. Oliver, but in case we have a different set of issues, in here we have a decompression table. And in the decompression table, we're basically doing flexion and distraction, and we're giving feedback to the system passively, which is different than actively. And our table can actually create a decompression of the spine and then come back up for a lot of lumbar disc reactions. And that's one of the best things that we see with a chronic lumbar disc herniation. In here on these screens, this is where we go over all of our tests. Every test that we performed in there, we keep it private in here with our patients. We can go through all the diagnosis so all can see. It's really great because when we do follow-ups, we redo the tests and we see and we can compare what's actually making a difference to your brain and to the functionality of your life.
So these are other little tools that we use in here. I've got some in my room. These are Dr. Hatch's he has in here. The vibrocussor system in concert with the arthrostim. Just fancy ways of saying these are how we use fairly light force techniques to adjust the body the way that it needs. Our job is to figure out what's wrong with the patient and give the body the stimulation necessary to thrive and to heal. So these are pieces of equipment that we use to help our patients when we're working on them in the treatment rooms. Okay, come on out here. We'll just take a look at what we've got in the general room here. We'll start with this one here. This is a really cool piece of equipment we got from a company called Cadwell. It's a combination of different things. It actually does EEG, which is a way we analyze brain waves, brain function. It does NCV, which is nerve conduction velocity. If you feel weak in an arm, you're having a hard time using your hand, this thing can actually measure how well the nerve is actually conducting, how fast it's moving. Now, in our scope of practice, we don't use those diagnostics because we're not going to penetrate the skin with needle EMGs or NCVs. What we use this for is somatosensory evoked potential, which is, in layman's terms, just simply stated, we use this two-pronged setup to stimulate certain peripheral nerves, and we stimulate the nerves that we want to stimulate to make effects on the brain that we want to make effects on. Essentially, that's what we do. So oftentimes we'll work this around a patient's face where we're doing the branch V1 of the trigeminal nerve. We'll come over here and do V2. We'll get on the tongue so we can do hypoglossal stim. We'll come down and work on the median nerves. We'll do, there's a specific protocol that we do for gait that we call the gait protocol that works really well if we want to help people walk better and move better. So this is an awesome piece of equipment that we use every day, all day long. So
Great.
Dr. Hatch has got a cool story to tell about the laser. We'll get into this in a different episode, but he's got something to share.
And this is the MR4. We use this for it's a laser therapy that helps activate the proto-oncogenes at the cellular level to replenish. This last December, I fractured my L4. It's the lateral TP. It's not the weight-bearing vertebrae, but the little lateral that all your little back muscles attach to, and it was fractured. And I used this for 2 weeks straight. And in 2 weeks, I was back to work, walking, functioning, moving, because of its rapid activation of the tissue cells. And I love it. Okay.
We use this all the time post-surgery. If you know anyone that's in pain, muscle spasm, edema, swelling, inflammation. If you know anyone that's ever been injured, which is everybody, this is what we use this piece of equipment for healing. Okay, this is another piece of equipment we've got right next to it. We often use these two in concert. This one's more specific for neuropathies, whether it's a diabetic polyneuropathy, a disc herniation in your back that's causing sciatica, a disc herniation in your neck that's mimicking thoracic outlet syndrome, for example, numbness and tingling into these two fingers. There's a wide variety of uses for this, but it's basically for radiculopathies and neuropathies. And we'll get into this and describe more of how it works and how we use it. Dr. Hatch has got the hyperbaric oxygen
This is a
therapy.
hyperbaric oxygen chamber. We use this as in concert with tissue healing. It rapidly heals tissue by getting oxygen into the system and then using pressure. What we call it is a dive. So you dive down because you're going down into pressure like you're scuba diving. Well, with the oxygenation that you're breathing in and the pressure, it gets the oxygen to push through the cells. Dr. Harsh, the leading HBOT medical doctor at LSU, wrote a phenomenal book on oxygen therapy and how it relates to healing and the rapidness that they're seeing in patients with strokes, patients with diabetic wound neuropathies.
Concussions, traumatic brain injuries. I mean, you name it. He says multiple times in the book, I found it kind of funny, but it's true. It's really cool. He says, this isn't a cure-all, but, and then he goes on to expound, it can help this condition, that condition, this condition, because we're using essentially oxygen as medication, okay? It's phenomenal. We love this piece of equipment. Thank you guys for joining us. We're glad you were able to come through, take a look at our clinic. Again, we're part of the Really Cool Humans Network. I'm Dr. Casey Oliver.
And I'm Dr. John Hatch. Thank you for tuning in, and we look forward to taking this journey with you.
And if you want to contact our clinic, feel free to access our website. It's theneuroclinic.org, or contact us anytime by phone, area code 801-766-6580. See you next week.